Hey guys, welcome back to my channel. If you're new, my name is Faith Ojone and this is a quick video. Okay, this is a recent development. The UK government has announced a new care reform which was recently published. So I'm going to summarize everything for you. If you want to know more about this, you can go read the information for yourself on gov.uk. Without saying so much, let's get straight into it. The UK government has unveiled a comprehensive strategy to improve adult social care, emphasizing better support for care workers, granting independence for service users, and reduced pressure on the NHS. These measures will enhance the life of the elderly and disabled individuals while strengthening the workforce and modernizing care delivery. So here are some of the key highlights for care workers and service users. The number one key highlight is increased independence for disabled and elderly individuals. Government has allocated additional £86 million to disabled facility grants for this financial year, raising the total annual funding to around £711 million. This boost will enable 7,800 more individuals to make critical home adaptations, promoting independent living and reducing hospitalization. So the benefits for service users is that they will get easy access to home improvements such as stair lifts, ramps, and bathroom modifications. They will also have the benefit of greater ability to live independently in a familiar surroundings. There will be fewer hospital visits and shorter stays, ensuring better quality of life. This is amazing for service user. No more staying in the hospital, you just stay where you're comfortable. The second one is the care technology. There will be a major focus on integrating technology into care delivery. The new national standards for care technology will ensure the adaptation of tools like force sensors and remote monitoring system. The benefits for having this technology for service user is that service users and their families can confidently select effective, secure technologies. And the second one is it will reduce risks of falls and faster response time during emergency. So there'll be a technology in their house to monitor everything. The third benefit is that longer period of independent living, reducing hospital admission. So the family can monitor the elderly people or disabled people with this new technology. Career development for care workers. The government will enhance the national career structure for care workers, creating pathways for professional growth and advanced training. Care workers will also be supported to take on healthcare tasks such as blood pressure checks, reducing the need for hospital visits. So the benefits for care workers is that it's opportunity for skill development and career progression. Care workers will be trained to be able to do more stuff. The second benefit is that recognition of critical role in healthcare delivery, improve morale and retention due to professional growth. The benefits for service users is that more healthcare services will be provided at the comfort of their house, continuity of care from skilled professionals who understand their needs. So care workers will be trained to be able to attend to the elderly and disabled people at home. There will be improved data sharing between NHS and social care, and a shared digital platform will enable seamless communication between the NHS and the care staff, giving real-time access to essential medical records. So the benefits of this is that there will be faster and more informed decision making for care users, and it will reduce administrative burden for care workers. It will enhance collaboration between health and care provider. The government's immediate work to support the social care sector plan will also professionalize the workforce by expanding national career structure, ensuring that there are recognized career progression and development pathways, encourage people to stay in the care workforce for longer. Alongside this, the government will crack down on abuse of social care visa and strengthen sanctions for those exploiting the care worker visa routes, and support workers who have been displaced as a result of actions already taken against employers. The government will not hesitate to go further to tackle abuse if necessary. The government is making available up to £3.7 billion of additional funding for social care authorities in 2025 to 2026, which include an 880 million increase in the social care grant. The government is already taking action to tackle the challenges facing adult social care and taking first steps towards building a national care services by introducing legislation that will establish the first ever fair pay agreement for care professionals. This is amazing. To address the long-standing issues, the government will launch an independent commission chaired by the Baroness Casey. This commission will work towards creating a national care service with consistent standard across the country. There will also be a long-term goals and plan by the government. The long-term goals is to identify and address critical issues in adult social care, develop a roadmap for medium and long-term reforms, and build a sustainable system as well that meets the need of an aging population. A dual approach, immediate action, reform for better care, fund to support care transitions from hospitals to home, and to focus on prevention. Ensuring local systems used £9 billion in funding to improve emergency admissions, delayed discharge, and care homes transitions. There will be a long-term vision to commission two-phase strategy which will lay out the ground for a sustainable national care service. The phase 1, which will happen in 2026, that's next year, which will address immediate challenges and set recommendations for medium-term reforms. The phase 2 will begin 2028, which is like proposed long-term solutions to meet the need of an aging populations, including funding strategies and service model. The government initiative promised a brighter future for adult social care in the UK, and the immediate investment will empower care workers and enhance independency for service users and ease NHS pressure. So this is like good news for both care workers and service users. So if you work in the care sector as a carer or support worker, the government reform is beneficial to both you and the service user. This is a summary of everything that the government has published. Thank you so much for watching. If this video was helpful, you know what to do. Give it a thumbs up, share, comment, subscribe, and I'll see you guys in my next video. Bye.